Hi, this is Joanne, and I want to welcome you yet again to another episode of the Joanne's Wellness Hub. Now, I have had several people ask me to talk about polycystic ovarian syndrome in depth, and I'm here to talk about it. So, we said that polycystic ovarian syndrome is a condition that affects women, and it's quite common. It's more common than you actually think. And this is a disorder that is characterized by three main things. And one, we have hyperandrogenism. So you find that there's excessive production of androgens, and as we continue, we will see what androgens are. Number two, there is an ovulation. So you find that the female is not able to ovulate. And number three is polycystic ovaries, which are noted on ultrasound. And we have different features, or if you want to know about if you could be having this condition, we have different clinical features or symptoms and signs. And one of them that is very common is an ovulation, or you find that the patient or the female is not able to have their menses, or they have irregular menses. So you find that maybe they have their menses this month, and then they skip maybe 2 months, and then they have their menses maybe after an extended period of time, or you even find that some do not ovulate at all. Another issue that mainly is accompanied with this definitely is infertility. So you find that most of these patients who have polycystic ovarian syndrome, they mainly struggle with infertility. And the infertility definitely is because the female is not able to ovulate, because for fertilization to take place, definitely, or for you to get pregnant, you need to have, or ovulation has to take place so that fertilization can take place. And another symptoms, we have now symptoms that are related to hyperandrogenisms. And when you're talking of hyperandrogenisms, we have what we call androgens. So androgens are mainly the male hormones. So, and one of them that is quite common is testosterone. We have quite a number of other types of androgens. So you find that there's predominance of the male hormones. So if there's excessive production of these androgens, or the male hormones, in the female, definitely it's going to cause these hyperandrogenic symptoms. And one of them is what we call hirsutism. We have seen females who have excessive growth of hair on this region. So we've had what wenye wanasema maybe ni ndevu, but it's what we call hirsutism. So there's excessive growth of hair on the face, on the chest, and the back. That is as a result of hyperandrogenism, or excessive accumulation of the male hormones in the female system. Another one is acne. And acne is definitely going to occur because these excessive androgens, or these androgens, have an effect on the sebaceous glands. The sebaceous glands are on the skin, and these sebaceous glands are what produces sebum, the natural oil. So when you look at my face, and I'm quite oily and shiny, it's maybe because of that excessive production of sebum, which is the natural oil. So you find that these androgens stimulate the sebaceous glands to produce more sebum. So that is what causes acne, because if there's excessive production of sebum, then you find that your pores becomes very clogged, and definitely if they are clogged, then you have acne. And other symptoms, you can have insulin resistance becoming worse, but it's the insulin resistance mainly it's as a result of weight gain. So it's insulin resistance causes the worsening of the PCOS symptoms, and we are going to see how. So let's understand PCOS in depth, what actually happens. So in our brain, we have a gland that we call the hypothalamus, and we have another gland that we call the pituitary gland. And the pituitary gland is divided into two. We have the anterior pituitary gland and then the posterior pituitary gland. So the hypothalamus produces the releasing hormones. So in this case, when you're talking about the ovaries, now the reproductive system of the woman, this release of gonadotropin releasing hormone. And this hormone stimulates the anterior pituitary gland to release the luteinizing hormone, and the follicle stimulating hormone. The luteinizing hormone and the follicle stimulating hormones are the two main hormones that mainly regulate the menstrual cycle of the woman. Okay, so you have the releasing hormone, the gonadotropin releasing hormone by the hypothalamus, which stimulates the anterior pituitary gland to release the luteinizing hormone and the follicle stimulating hormone. In a normal instance, this process of production of luteinizing hormone and FSH, it's well coordinated, and so you find that there's a normal ratio of the luteinizing hormone and the follicle stimulating hormone. But in females or in patients who have polycystic ovarian syndrome, you find that there's a lot of production of luteinizing hormone and very less follicle stimulating hormone being produced. Okay, and if follicle stimulating hormone, it's mainly what causes the production of or the formation of follicles. So in your ovaries as a woman, you have two ovaries on both sides. Okay, and in these ovaries, for ovulation to take place or in a normal menstrual cycle, this follicle stimulating hormone causes the growth of follicles in your ovaries. That is from when now in the follicular phase of your menstruation, or in the first day of your cycle. Okay, and the first day of your cycle, it's from when you start having the menses. Okay, so there is formation of these follicles, and as these follicles are forming, it's only one follicle that mainly predominates. And in the mid-cycle, or in most women, the 14th day of ovulation, or the 14th day of the menstrual cycle, the follicle that has matured is released into the fallopian tube for fertilization to take place. So that is what we call ovulation. But for this to take place, there must be enough production of follicle stimulating hormone. Okay, so in patients who have PCOS, we have seen that this follicle stimulating hormone is produced in very little amount. So you find that these follicles are forming, yes, but none is maturing. So in response, you find that if none is maturing and ovulation is not taking place, you find that there is excessive accumulation of follicles, of these immature follicles in the ovaries. And when an ultrasound is done and you're told that you have polycystic ovarian syndrome, it's the immature follicles that are being, or that are seen on the ultrasound. So because of the less production of FSH, none of the follicles is maturing, and therefore there's no ovulation is not going to take place. And if ovulation is not going to take place, you find that there's a accumulation of excessive immature follicles in the fallopian, or I mean in the ovaries. And then we have said that there's excessive production of luteinizing hormone. The main role of luteinizing hormone in a normal woman who doesn't have PCOS or any hormonal imbalance issues, the main role of luteinizing hormone is to promote ovulation. Okay, mainly when luteinizing hormone is produced, it helps to allow this mature follicle to come into the fallopian tube so that fertilization can take place. Okay, so now that ovulation is not taking place and there is excessive production of luteinizing hormone, another impact of luteinizing hormone is in these immature follicles, you have the thicker cells, what you call the thicker cells in these immature follicles. So this luteinizing hormone stimulates the thicker cells to produce a lot of androgens, because remember that there's excess luteinizing hormone and that is not even being used for ovulation. So there's excessive production of the androgens. And we are saying that these androgens are like testosterone and quite a number other examples of the androgens. So that is all about now how luteinizing hormone and follicle stimulating hormone cause worsening of the androgenic symptoms and also affecting ovulation. Now, we have the other side of PCOS. You know that PCOS and insulin resistance are very related. They are two related things. And this is what happens. Insulin is a hormone that is produced by the beta cells of the pancreas. Okay, so it's produced in response to elevated glucose levels in the bloodstream. So when you take your meal and you have glucose in the system, glucose is what helps to produce energy. So it's the main source of energy in our bodies. So when you take this glucose, glucose is utilized by three main tissues. We have the muscle tissue, we have the adipose tissue or the fat tissue, and then we have the liver. So for glucose to be uptaken by these tissues, it requires insulin, because on these tissues you have receptors that mainly that insulin activates so that glucose can come into those tissues. So in patients who have insulin resistance due to different reasons, and one of them being overweight or being obese, or if you're having type 2 diabetes. So if there's insulin resistance, definitely if there's insulin resistance, there's going to be hyperinsulinemia, because as a response, because of this insulin resistance, as a response, the pancreas is going to produce more insulin and cause what we call hyperinsulinemia. And if there's excessive insulin circulating in the system, you'll have different effects. One of them, excessive insulin or excess insulin reduces the production of what we call the sex hormone binding globulin. And the sex hormone binding globulin is mainly produced by the liver, and its main function is to bind the excess androgens like testosterone. So that means if there is excessive or reduction in the production of this sex hormone binding globulin, then you find that the circulating androgens are a lot because they cannot be binded. Okay. And another thing, insulin also works together with the luteinizing hormone to worsen the production of androgens by the thicker cells, in the follicles that we were talking about. And this causes excessive circulation of androgens in the system and worsening the symptoms. So you may be asking, what should I do if I have PCOS? What is the management? So lifestyle modifications play a major role in polycystic ovarian syndrome. One of the things that you need to do is ensuring that you're exercising or you're physically active. So make sure you exercise, because the more you exercise, you reduce the insulin resistance. And that means that you're dealing with the excess insulin that is circulating in the system. And so you find that you're also helping with the androgenic effects or the excess androgen circulating in the system. So weight loss. Another thing is diet. So you need to be very careful so that whatever foods that you're taking, you avoid the high glycemic index foods or the foods that are causing excessive circulation of glucose in the system. And these foods are mainly the very processed foods. So we have things like rice, wheat, ugali, sugary drinks or sugary foods or snacks, anything that causes excessive circulation of glucose in the system. But instead, you can go for all grains, okay, and also foods that are not associated with excess glucose in the system. So diet and exercise play a very major role. Weight loss also is very important, because weight loss helps to reduce the insulin resistance. But we also have drugs that actually help to manage polycystic ovarian syndrome. As you know, PCOS is a chronic disease, which means you cannot treat PCOS completely until you maliza the PCOS. So you have to manage. It's a chronic disease, which means that you can only manage the condition, lakini haitaisha kabisa. What do I mean? So there are drugs that have been shown to help reduce the effects of PCOS, and I'm not going to give the medical advice right here. So if you have these symptoms, you can go to hospital, but drugs are there that can help with reducing the symptoms of PCOS. There are those that helps to reduce insulin resistance. There are those that help to reduce the effects the effects of the androgenic symptoms, drugs like spironolactone, and also we have drugs that help regulate your cycle, the combined oral contraceptives. But definitely you need to go to hospital so that these drugs can be prescribed by a doctor or by a doctor. So you need to go to hospital so that you can be treated. The parting shot is that there's hope. If you have polycystic ovarian syndrome, even if it is a chronic disease, there's hope that you can live with it as long as you adopt a healthy lifestyle and you know yourself that you have PCOS, and PCOS increases my risk for various diseases, because if you still struggle with weight, with excessive weight in PCOS, this predisposes you to quite a number of conditions, one of them being type 2 diabetes. But it is doable. With PCOS, it is doable. You can manage the condition and you live a very healthy lifestyle. You can also get pregnant. It doesn't mean that now when you have PCOS you cannot get pregnant. When you go to hospital, you're treated, you can actually get pregnant as long as ovulation is taking place. So that is just an encouragement. Let me know if there's anything else you want me to talk about regarding PCOS. I have recorded this long video because of the demands. Quite a number of people have been telling me to talk about polycystic ovarian syndrome. Thank you so much.